Botox is botulism toxin, and it's a neuromuscular toxin that inhibits the muscles from moving wherever it's injected. So Botox is used to treat dynamic lines. Dynamic lines are those lines that you see when you're making a facial expression, such as smiling, frowning, raising your eyebrows. So any wrinkles that you see when the face is making those motions, Botox will limit those movements by inhibiting that muscle movement. Fillers are more for volume loss. So typically I describe it as whenever there are lines on your face that are present at rest or in a static state, those are the things that require volume or filler. Typically no. So immediately after the Botox injections, you'll have a little bit of localized swelling. I often compare it to mosquito bites. In 5 to 10 minutes, the injections are gone. There is a slight chance of bruising after the injection. But Botox usually takes about 4 to 5 days to kick in, a full result by 2 weeks. Typically nobody will notice that you've had work done with the right injector. So you want to seek out an injector that will give you a natural looking result, preserve movement, and eliminate the wrinkles that you came in to be treated for. A little bit of a pinch. People will say that there's a pinch, but it's very well tolerated. Not severe pain, nothing that requires localized anesthesia or anything like that. Localized skin reaction, as I said, bruising, swelling, just for momentary, 5 to 10 minutes. The worst case scenario with Botox is if it's placed in an area that it migrates and drops the brow, and that's called ptosis, where you get brow drop or lid lag, and that's due to a placement issue or product migration. So we try very hard when we inject the patient to avoid those what we call danger zones and stick to the areas where that would not be an issue. The treatment takes usually anywhere from 5 to 10 minutes, honestly. I typically mark patients, go over what I'm doing, and the education and instruction take a little bit longer than the injections themselves. In a 15-minute visit, I can cover all of that usually. Results happen anywhere from 4 to 5 days, but full result by 2 weeks. So often I will tell patients not to expect any touch-up or modification of their Botox treatment until that 2-week mark, because often the product is working to get settled in up until that time. But it lasts anywhere from 3 months, and some patients get 6 months. It really varies on, it's patient-specific. Botox, Dysport, and Xeomin are all forms of the botulism toxin. They're all marketed a little bit differently. Dysport has a sooner onset, and duration is essentially the same as Botox and how long it lasts. Xeomin is the most pure form of Botox, but they all contain the same amount. It's just different manufacturers, and they work very similarly. I've used all three in my patients, and they work similarly.